Hey guys, today we will be talking about the upper limb, specifically the shoulder and the arm. To give you an overview of what we will be talking about today. So first, we will talk about the osteology of the upper limb. Next are the joints, the muscles, nerves, vasculature, and the lymphatics. Going back to our anatomy, it is composed of the upper limb and the lower limb. The upper limb is divided into the arm and the forearm, while your lower limb is composed of the thigh and the leg. Now, we will talk about the shoulder and the arm. The upper limb. The upper limb is composed of three bones: the clavicle, scapula, and the humerus. The clavicle, also known as the collarbone, is a long bone which consists of a sternal head and an acromial head. Its sternal end is inserted at the manubrium of the sternum, while its acromial end is inserted at the acromion of the scapula. Again, the clavicle is composed of the acromial end, the body, and the sternal end of the clavicle. Note the position and shape of the clavicle. Anteriorly, the medial part, which is near the sternal end of the clavicle, faces convexly. The landmarks of the clavicle includes the acromial facet of clavicle, the conoid tubercle, the groove for subclavius muscle. The conoid tubercle is a small roughened elevation on the inferior surface near the acromial end. This serves as the attachment area for the conoid ligament part of the coracoclavicular ligament. Next is the impression for costoclavicular ligament, sternal facet of clavicle, the trapezoid line. Another part of the osteology are the joints. First are the sternoclavicular joints. Second are the acromioclavicular joints. And notice the specific ligaments attached. Look at the cross-section of the clavicle. So how is this beneficial to us as future doctors? We will take a look at some clinical conditions. First is the AC joint dislocation grade 1. Grade 1 sprains involve only partial damage to the joint capsule and the acromioclavicular ligament. Grade 2 dislocation happens when there is a partial dislocation of the joint in which there may be some displacement and may not be obvious during a physical examination. Grade 3 AC joint dislocation involves the complete rupture of the acromioclavicular and coracoclavicular ligaments. The acromioclavicular joint osteoarthritis. It is a type of shoulder arthritis that involves degenerative changes to the cartilage and other structures in the acromioclavicular joint, leading to pain, stiffness, and weakness in front of the shoulder. Next, clavicular fracture and AC joint dislocation. Injuries around the clavicle are quite common. Furthermore, AC joint dislocation combined with fracture of the distal end of the clavicle are quite frequent and well recognized. Next bone is the scapula. The scapula is a flat bone. It articulates with the acromial end of the clavicle and head of the humerus. The scapula consists of different parts. First is the acromion, located at the back side of the scapula. Next is the body of the scapula, which the subscapularis muscle is attached. The coracoid process, which lies at the front side of the scapula, and the neck of the scapula. Other parts of the scapula includes the subscapular fossa for the subscapularis muscle, supraspinous fossa for the supraspinatus muscle, and the infraspinous fossa for the infraspinatus muscle. Inferior angle for the levator scapular muscle, inferior angle of the scapula, and the lateral angle of the scapula. inner border, the medial border, the lateral border, and the superior scapular notch are the surfaces of the scapula. Clinical condition, we have what we call as the wing scapula. Wing scapula is characterized by a dropped shoulder due to the paralysis of trapezius and caused by the paralysis of the serratus anterior muscle. The next bone is the humerus. It is a long bone that articulates with the glenoid cavity of the scapula, head of the radius, and trochlear notch of the ulna. It is composed of the anatomical neck of the humerus, body of the humerus, condyle of the humerus, head of the humerus, greater tubercle, and lastly, the lesser tubercle. We also have different landmarks, which includes the capitulum that attaches to the radius, coronoid fossa, crest of greater tubercle, and the crest for the lesser tubercle. Other landmarks include the groove for the radial nerve, groove for ulnar nerve, intertubercular fossa, deltoid tuberosity, the radial fossa, surgical neck of the humerus, as what I had said earlier, olecranon fossa, and the trochlea of the humerus, which attaches to the ulna. And the joint that is involved is the glenohumeral joint. The clinical condition involved is the rotator cuff tear. Rotator cuff muscles is involved in the stabilization of your shoulder joint. These are the subscapularis, supraspinatus, infraspinatus, and teres minor muscles. Now we will move on with the shoulder and arm muscles. We have the pectoralis major and minor muscles, the subclavius muscles, the serratus anterior muscle. First, we will talk about the pectoralis major muscle. It is involved in the adduction of the arm, and it is innervated by the medial and lateral pectoral nerves. It is also supplied by thoracoacromial artery, the pectoralis minor muscle. Its action, retraction, and downwardly rotates pectoral girdle at acromioclavicular joint and sternoclavicular joint. It is innervated by the medial and lateral pectoral nerve. It is supplied also by the thoracoacromial artery. The subclavius muscle. It stabilizes the clavicle. It is innervated by the nerve to the subclavius. It is supplied by the clavicular branch of the thoracoacromial artery and the suprascapular artery. So we have the serratus anterior muscle. It protracts and upwardly rotates pectoral girdle at AC and SC joints. It's innervated by the long thoracic nerve and supplied by the lateral thoracic arteries and thoracodorsal artery. To the pectoral group, we will move on with the back superficial muscles. Hey, are you familiar with this? This is what we had in our first days in the anatomy class. We have the trapezius muscle. It elevates, retracts, and upwardly rotates the pectoral girdle at AC and SC joints. It is supplied by the occipital artery and innervated by the accessory nerve and anterior rami of the C3 and C4 nerves. This is the latissimus dorsi muscle. It adducts, medially rotates, and extends arm at glenohumeral joint. It is innervated by the thoracodorsal nerve and supplied by the thoracodorsal artery, dorsal branches of 9 to 11. The levator scapulae muscle. It elevates and downwardly rotates pectoral girdle at AC and SC joints. It is innervated by the dorsal scapular nerve, and its blood supply is the transverse cervical artery and ascending cervical artery and the vertebral artery. The rhomboid minor. It retracts and downwardly rotates the pectoral girdle at SC and AC joints. Its nerve supply is the dorsal scapular nerve and arterial supply is the dorsal scapular artery. We have the rhomboid major, which retracts and downwardly rotates pectoral girdle at AC and SC joints. It is innervated by the dorsal scapular nerve and is supplied by the dorsal scapular artery. We have the scapular region muscles, involving the subscapularis muscle, Next, we have the deltoid muscle. It extends, laterally rotates, and transversely abducts arm at glenohumeral joint. It is innervated by the axillary nerve. It is also supplied by the thoracoacromial artery. And have the supraspinatus muscle. It abducts and stabilizes arm at glenohumeral joints. It is innervated by the suprascapular nerve and supplied by the suprascapular artery and dorsal scapular artery. Bring it on, we have the infraspinatus muscle. It laterally rotates, transversely abducts, and stabilizes arm at glenohumeral joint. It is innervated by the suprascapular nerve and blood supply is suprascapular artery and circumflex scapular artery. We have the teres major muscle. It adapts and medially rotates arm at glenohumeral joint. It is innervated by the lower subscapular nerve, and its blood supply is composed of the circumflex scapular artery, subscapular artery, and posterior circumflex humeral artery. Take note, it is not part of your rotator cuff muscle. Teres minor muscle. It laterally rotates, transversely abducts, and stabilizes arm at glenohumeral joint. It is innervated by the axillary nerve, and its arterial supply is circumflex scapular artery and posterior circumflex humeral artery. Next, we have the subscapularis muscle. It medially rotates and stabilizes arm at glenohumeral joint. It's innervated by the upper and lower subscapular nerves, and arterial supply is the subscapular artery, suprascapular artery, and lateral thoracic artery. Next, we will talk about the arm muscles. So basically, these muscles are the first muscles that we can see in the persons who are always going at the gym. Short head of the biceps brachii. So it is part of the anterior compartment of the arm, and it flexes forearm at elbow joints, supinates forearm at radioulnar joints. It is innervated by the musculocutaneous nerve and the brachial artery and anterior circumflex humeral artery are its blood supply. Next, we also have the long head of the biceps brachii. It flexes forearm at elbow joint, supinates forearm at radioulnar joint. It is innervated by the musculocutaneous nerve, and its blood supply is composed of the brachial artery and the anterior circumflex humeral artery. We have the coracobrachialis muscle, which adapts and flexes arm at the glenohumeral joint. It is innervated by the musculocutaneous nerve and is arterial supply the brachial artery and anterior circumflex humeral artery. Brachialis muscle, which flexes forearm at elbow joint. It is innervated by the musculocutaneous nerve and radial nerve. It is blood supply to the brachial artery, radial recurrent artery, and superior ulnar collateral artery. After we had take a look with the anterior compartment, let's now move on to the posterior compartment of the arm, which consists of the triceps muscle. It is composed of the long head, the lateral head, and the medial head of the triceps brachii muscle. The long head of the triceps brachii muscle, it extends at the forearm at the elbow joint. It is innervated by the radial nerve, and its arterial supply is the deep brachial artery, superior ulnar collateral artery, and the posterior circumflex humeral artery. Next, we have the lateral head of the triceps. It extends forearm at elbow joint. It is innervated by the radial nerve, and its arterial supply deep brachial artery and the posterior circumflex humeral artery. Lastly, we have the medial head of the triceps. It extends forearm at the elbow joint. It is innervated by the radial nerve, and its blood supply are the deep brachial artery and superior ulnar collateral artery. Come on and let's take a look at the cross-section of the pectoral region. So we can see the clavicle, the supraspinatus muscle, the serratus anterior muscle, and then we have the right shoulder cross-section. Shoulder cross-section would show different muscles involving the biceps and the triceps brachii muscle. We have the right arm cross-section, which we can observe the biceps and the triceps brachii muscle and also the coracobrachialis muscle. Part of the overview that I had talked about in the first slide is that we will also include the vasculature nerves and the lymph involved in the upper limb. The nerves is composed of the brachial plexus. Its roots will form trunks, which is composed of the superior, the middle, and the inferior trunk. And then the trunks will form the different divisions, which is the anterior and posterior. The anterior divisions of the upper and middle trunk forms the lateral cord. The posterior divisions of the upper, middle, and lower trunk forms the posterior cord, and the anterior division of the lower trunk forms the medial cord of the brachial plexus. We also have the brachial artery. The brachial artery is technically a branch of the axillary artery. It goes down and down and down, and then it extends to become the radial collateral artery, inferior ulnar collateral artery, as we can see in the pointed illustration. And we also can see the deep brachial artery. So these are the branches of your brachial artery. We have the cephalic vein, and we have the cephalic vein, and then the axillary vein, the anterior circumflex humeral vein. The brachial artery is also being pointed, and the basilic vein. So the conditions of the shoulder and arm muscles includes vascular necrosis of the shoulder, the distal biceps tear. Observe how the video shows this tear in the distal biceps and look closely. Have the Hill-Sachs lesion. Most particularly in the head of the humerus, near the attachment of the glenoid. Have the arm lymph nodes. So the brachial lymph nodes receive lymph from the ulnar and radial lymph vessels of the forearm and the brachial lymph vessels of the arm. Lastly, we have the pectoral lymph nodes. So be careful when handling mastectomy with patients because you might harm these types of nodes. So illustrated are the different types of nodes found in the pectoral region. So thank you for listening, everyone. I hope you had learned a lot from our lecture for today, the shoulder and the arm.